This is WCNY's The Capitol Press Room, and we're exploring the state of New York's nursing homes and the industry's wish list for this year's budget. And our guest in the studio is Stephen Hanse, head of the New York State Health Facilities Association and New York State Center for Assisted Living, which represents more than 400 nursing homes and assisted living facilities across the Empire State. Welcome back to the show, Stephen.
David, thank you for having me.
Well, heading into this budget process, which is critical to your members because of the role Medicaid plays in covering your costs, how would you describe the status quo as it pertains both to recruiting and retaining staff, your bed capacity, and just keeping doors open at your members all over the state?
Sure. Right now, the situation nursing homes are facing throughout the state of New York is a situation where the state has had a policy of disinvestment in nursing homes for over 15 years, going to the prior administration. New York has underfunded the cost of care for a Medicaid resident in a nursing home from 50 to 75%. So nursing homes are struggling and with just to keep the doors open. We've seen in the last couple of years over 14 nursing homes close. Right here in the Capital Region, we saw St. Peter's last week announced they're closing a 160-bed facility. So it's a struggle right now. The current administration is trying to correct this disinvestment in nursing homes throughout New York State. The current budget proposal from the governor allocates $1.5 billion for hospitals and nursing homes, and both the Senate and the Assembly build upon the governor's investment. So it's trying to turn this around, but it's not going to happen in a day. It's not going to happen in one budget cycle. And with that, providers are struggling.
So you made the case that the status quo represents a disinvestment in nursing homes. But if you look at Medicaid spending year over year, there is big growth. So does that mean nursing home isn't getting increases year over year? Or is it the case that the increases just aren't keeping up with the demand that you have? Or maybe we starting from a place that it was so underfunded that the increases are, taking a bucket to a ship that has too big a hole, losing water?
It's twofold. The growth in Medicaid spending in the state of New York is not attributable to nursing homes. There's a static number of nursing home beds, almost about 100,000. That number remains static. New York is not building new nursing homes. It would be extremely costly to build new nursing homes. That's why we're calling for investing in current nursing homes. If you go back in time, the prior administration eliminated what was called the trend factor for inflation. That was about 16 years ago. New York had a methodology in place where each year there would be an incremental increase in the Medicaid rate for nursing homes, coinciding with any inflation rate. So if the inflation rate was 2.5%, 3%, there'd be that incremental increase in the Medicaid rate for nursing homes. The prior administration eliminated that and created this policy of disinvestment in nursing homes. And it became so bad that New York State has the dubious distinction of the only state in the nation that cut Medicaid to nursing homes during the COVID-19 pandemic. New York cut Medicaid to nursing homes. We're on the front line of the pandemic by 1%. All 49 other states added money, invested in nursing homes. New York disinvested. So right now we're in a situation where we need to right that ship. We need to turn it around. Governor Hochul, to her credit, is doing that with her investment in nursing homes, and the legislature is recognizing that we are facing an ever-increasing aging population. The state plan for the aging, that shows that by 2030, we don't have enough people, or the number of people able to care for those 65 and older is diminishing to 2.8 persons per person over that age. So it's a process. It's going to take time, but it's something that has to happen now.
And you mentioned that $1.5 billion in new funding that the governor proposed in her executive budget. At least initially, there wasn't any clarity about how they were looking to divide that money. Is there any sense of that as we talk now with just a few weeks before the state budget is due? And if not, if you are still getting a chance to weigh in on that. What do you think the split should be like? How much should go to nursing homes and the 98,000 beds that you operate?
Sure. 750 million of that 1.5 billion should and needs to go to nursing homes.
Even split.
Even split. But what we are seeing is a recognition in both the Senate and the Assembly that there are more funds available. Certain additional Medicaid dollars are available to the states. So you'll see in the one House budgets, the Assembly proposes $940 million for nursing homes, assisted living programs, and hospice programs. The Assembly allocates approximately $2.3 billion for hospitals and nursing homes. So the legislature is ready to make that investment and partner with the governor to make that investment in nursing homes. So at a minimum, we need $750 million to start. That won't even cover the cost of a Medicaid resident in a nursing home. And that's the fundamental issue here. New York fails to cover the cost of care for a Medicaid resident in a nursing home. And we need to get to a place, and it won't happen in this budget cycle, but we need to get to a place where New York does cover the cost of care for that individual.
Well, before we move on, let me reintroduce you. For listeners just joining us, this is WCNY's The Capitol Press Room, and we're speaking with Stephen Hanse, who is the head of associations representing more than 400 nursing homes and assisted living facilities across the Empire State. So you've been framing this as an investment, and I would argue that it's more about covering operating costs, and investment is more of like, hey, look at this investment grow and plant a seed, and look what flourishes. So is there anything that would be more tantamount to an investment that the state could do to either solve some of these long-term problems that spending money now is going to yield some sort of long-term results? Because the spending we're talking about, you got to follow it up the next year. You can't just make that money disappear.
Absolutely. The money that we're requesting, that $750 million, that has to go in the base rate.
Sure.
It can't be a lump sum, because the critical interplay here is the recruitment and retention of staff. We need those monies to be able to compete in the labor market against the big box stores, against retail,
right,
to recruit and retain a workforce, because it's critical that nursing homes retain their staff. The more someone works for nursing homes, the more they become aware of their residents' needs and care needs and all of that. The familiarity really increases.
Right, but that's operating costs. So is there anything that really represents an investment that you're looking for, whether it's capital dollars or anything that might potentially result in some long-term savings down the road and maybe make the delivery of this service more affordable, or maybe help people avoid nursing homes so then you don't have maybe the demand for beds the same way?
Well, two things. From a capital perspective, going back to the state's policy of disinvestment, the state had cut the capital component of a nursing home Medicaid rate by 15%. They first cut it 5% and then 10% in the last 5 or 6 years. Governor Hochul, her budget proposal restores 10% of that 15% cut. The Senate and the Assembly both do a full restoration of that 15%. And what those capital dollars are meant for and what they're used for is investing and upgrading nursing homes. Here we are in a post-COVID paradigm. Facilities are getting older and older. As I mentioned, New York's not building new nursing homes, so we need to invest in the ones we have. Whether your chiller goes, your roof goes, your window goes, nursing homes need continual upgrades, and that capital that capital cut, the restoration of that capital cut, is essential to maintaining and enhancing these facilities. Getting to a point where New York covers the cost of a Medicaid resident in a nursing home, that is that investment. Because once that cost is covered and you get on solid financial footing, and we don't have nursing homes closing, 75% of the nursing homes in the state of New York right now are in the red. So we need to get to a point, and that is an investment. That is, okay, we're investing in our seniors. We're investing in those who are unable to receive care at home. They're unable to receive. The acuity level right now of residents in a nursing home is such that there's no other option for them to receive quality care.
We often hear, though, from a lot of providers before the nursing home space who say, if we spent X amount of dollars on X, Y, and Z, we could avoid sending people to nursing homes. Are they making serious arguments? Are there real things that could be done right now, maybe that would save money that costs less than a nursing home to keep people out of nursing homes?
Well, right now, and I was speaking to a legislator recently, and I said, if you closed your eyes, came with me, and then you opened them, and I said, where are you? You would say you were in a hospital. And you're not. You're in a nursing home, because it's such that the acuity level and the care needs of the residents in our nursing homes are such that there really isn't an option at home. You would need 24-hour nursing. You would need lots of clinical issues. We have, individuals with respiratory needs, multiple ADL issues. They can't receive the necessary care and quality of life at home. So really, the investment has to go to that nursing home. What we've seen too, when you look at some of the investments, that those taking it outside of the nursing home space actually increase costs. Going back to that earlier point, what we're seeing is hospitals. When hospitals aren't able to discharge to nursing homes, the beds aren't available because the investment isn't there and they don't have the staff. You see situations where those hospital patients have to remain in the hospitals, causes those backups, and the cost of care in those hospitals is twice, if not more, than the cost of care in a nursing home.
So the issue we've been talking about is that the nursing home patients, the vast majority of them are having their bills paid by Medicaid. Is part of the answer in the long term, in terms of addressing the state and federal government's cost here, about getting more people to secure long-term care coverage, to have some sort of private insurance paying their nursing home bills, or is that not a realistic option?
Long-term care insurance is not an option anymore. I believe there may be one insurance company that offers that as an option. You've seen the market for long-term care insurance really disappear in New York State and throughout the nation.
Should we be trying to bring it back then? Should we be trying to figure out how to make that more viable so that people are more responsible for their own long-term care?
I don't think the premiums, I don't think people
make it work?
Yeah, the math, I don't think people make enough money.
I shouldn't tell my 23-year-old producer to start planning for her care?
I don't think that's an option. And it's really, the state just needs to make a commitment to care for its residents. It's most vulnerable residents, quite frankly. It's when you get to the core needs of the creation of the Medicaid system. Individuals in nursing homes are aging, are most medically frail. Those are the populations that historically Medicaid at its genesis were designed to help provide care for, and we need to get back to that. We need to invest in that.
Anything that could bring down the cost of nursing home care?
Really, well, the cost of nursing home care is directly tied to the cost of everything in society. I mean, when you run an operation, when you see wages go up year after year after year, you see costs, you see utility bills go up year after year after year, you see all this inflation go up year after year. Those are what we face. And again, going back to the point where New York eliminated that trend factor for inflation 16 years ago, if we didn't eliminate that, it would just be an incremental increase, an inflationary increase, and we wouldn't have these drastic situations, these crisis situations where we need to invest now or we really jeopardize the care and well-being of folks in nursing homes.
Well, we've been speaking with Stephen Hanse. He's the head of the New York State Health Facilities Association and New York State Center for Assisted Living. Stephen, thanks for visiting us in the studio.
David, it's my pleasure. Thank you for having me.
Support for the Capitol Press Room is provided in part by the Lawsuit Reform Alliance of New York. Fraud and lawsuit abuse impact car insurance costs for New Yorkers. Reforms are being proposed to mitigate their impact. Information on these reforms is available at keepnewyorkaffordable.org.